Hello, my name is Melissa. I am a nursing student at Utah Tech University. Here is my photo identification. I am doing a capstone reflection presentation for my nursing synthesis course. And I will tell you a little bit about that now. So my project was recognizing and reporting sepsis in the home care setting. A little bit of background: I am a nurse case manager at a home health company. So I chose this project because we actually do safety huddles and meetings every morning where we discuss new concerns, any concerns about patient safety, ways we can improve, missed lab work, all of that type of stuff. And it was brought to our attention that when we were looking at rehospitalizations from home health, that several of them were from sepsis. And then when we looked even further into that and we're doing chart auditing, it was discovered that there were several times in which a nurse did not recognize the signs and symptoms of sepsis in the vital signs and did not report this or advise the patient to go to the ER, or if they did not document, or it was not made clear what had happened. So that's where I came up with this idea to educate staff about sepsis. So the focus, again, was just providing education to nursing staff on signs and symptoms of infection and sepsis, as well as reviewing appropriate documentation and reporting, and what follow-up looked like as well. When I started with this project, I thought about the benefits it could bring to my organization. Some of those were reducing hospital readmission rates for sepsis, improving patient care and safety, and focusing on improving community health. The mentor I chose for my project is actually one of my managers. She had the qualifications to be a mentor as set by our class. She has her RN MSN. She has 25 years of experience in the nursing field. And just on a personal note, she's just someone that I respect as a leader. She's not only kind and considerate and caring, but she's also firm in the ways that she needs to be, and she's just a great leader overall. Here are just some more examples and details about my project. How I presented my project was in a staff meeting with a PowerPoint presentation, and of course speaking alongside my visual presentation. So the PowerPoint included a definition of sepsis, facts about sepsis, sepsis signs and symptoms. I also gave real life examples from within our organization of situations where vital signs weren't reported, or the nurse did not, either they didn't recognize that this was sepsis, or they didn't document that they reported it as such. I also made laminated badge cards. In my presentation, I presented this mnemonic that is indicative of severe sepsis, and this is from the Sepsis Alliance. I included that same mnemonic from my presentation onto the laminated badge card so that it would correlate with my presentation, and hopefully the information would stick. So during this project, I was collaborating with several different colleagues. There were definitely some successes and some challenges as well. So some of the successes were my mentor was the one who actually came up with the idea of presenting this in the staff meeting, and she thought this would be the best way to get the information out to coworkers. She also gave me the idea of using case studies or real life examples from home health to educate. She facilitated this for me by creating time in the meeting for me to present. And she also referred me to the colleague who performed chart audits already. She was very open and supportive to my ideas, very willing to talk about anything And she was also very respectful and professional throughout this process and working together. Some of the challenges in this project were just coordinating and meeting up. Home health has some unique challenges when it comes to communication. We all work remotely, so we're not seeing each other on a daily basis or even a weekly basis most of the time. Most of the communication is done through Teams Messenger or phone calls or emails. So at times it was challenging coordinating our schedules to be in the same place to discuss the progress or challenges, and so that those were difficult at times. Another issue that came up was the colleague who I was referred to who had performed the chart audits. She actually just wasn't able to get back to me. She messaged me back maybe once or twice, but I think was very busy with her own schedule. So it didn't work out that way where I was able to use the audit she had already done. But I discussed that with my mentor, and we came up with a plan for me to listen in our safety meetings, because different nurses bring up examples of safety concerns and that type of thing. And I was able to find some case studies from those meetings. So that was great. So just evaluating my project. The project goals I believe I achieved was educating nursing staff on sepsis prevention. I was able to present and discuss everything and discuss education about sepsis. I was able to collaborate with colleagues, and I was able to focus on improving patient care. Just thinking about those goals I had set out with as far as benefits to the organization. It's hard to see right now, but hopefully in time we will see if rehospitalization rates due to sepsis improve, if patient care improves. So hopefully just having more educated staff that is more aware, this reflects well on the organization and improves our star ratings and improves the way people view the organization. If patients are getting good care, that should reflect on the organization as well. Benefits to my professional growth. This presentation went very well, and I've been asked to give this presentation again with my boss's boss, and they saw the potential of me maybe giving this presentation for different offices. Like I'm in the Salt Lake office, and they talked about me giving this presentation, maybe the Ogden and Provo offices as well. So it's definitely improved my ability to communicate and collaborate with colleagues. I was pushed out of my comfort zone and took an initiative to create change, and it has also showed me in the light of being able to take more on a leadership role. Yes, as well as it helped me be seen more as a leader and as a professional. So just in conclusion, the focus of my project was to educate staff on how they can prevent sepsis in home health. I created a presentation with handouts, and I presented it in a staff meeting with all my coworkers. Afterwards, I emailed surveys to coworkers to assess the effectiveness of this project. I did not get many responses back. I only got 4 back, but the questions in the survey were, was this presentation impactful, and do you see it improving your care in the clinical setting? And all of the surveys said yes. So I think overall my project seemed to have a positive impact. As far as the impact on my future practice, I have more confidence to initiate a project or change in the future. I've also thought about future career goals and interests. I have a real interest in epidemiology, and in community health, and in education research as well. So it kind of this project utilized all those different areas. And so I think it just gave me more things to think about of directions I may want to go in the future. And just even within my own position now, it may have opened new doors for me as a leader or educator within my company right now, within my current position. So Overall, this project was great, and thanks for listening.